Hi, everybody. Welcome back to the Pre-Med Pod. This is Maddie,
And I'm Sienna.
and today we're joined by Dr. Raskin, and I am so excited, guys, because I want to be a neurosurgeon, and this is our first neurosurgeon on the podcast, and we are so excited. So, Dr. Raskin, can you tell us a little bit about yourself?
Yeah, sure. It's a privilege to be here and talk with you all excited youth. So thanks for inviting me. I'm Jeffrey Raskin. I'm a pediatric neurosurgeon at Lurie Children's Hospital in Chicago. And I was, I guess, very quickly I was born and raised in Las Vegas, Nevada, and grew up there for 18 years and left for college at Pomona College in Southern California. And then I graduated with a emphasis in neuroscience. That was my major. And then I did a master's degree, 2-year master's degree at the Keck School of Medicine at USC in cell and neurobiology. And then I went back home to my state school, University of Nevada School of Medicine, where I majored. You don't really major in medicine, but you have an emphasis, and you have to eventually match into some discipline. And mine is, of course, neurosurgery. And then I went to Portland, Oregon at Oregon Health and Science University for 7 years and did neurosurgical training. And then after that, I went to Texas Children's Hospital in Houston and did a 1-year fellowship in pediatric neurosurgery. And then I took a job in Indianapolis, Indiana, where I worked for almost 5 years, building programs in functional neurosurgery for children. And then I left there about a year and a half ago and came here to Northwestern University and Lurie Children's Hospital. And so I'm currently assistant professor of neurological surgery, pediatric neurosurgeon at Lurie Children's Hospital, director of the functional neurosurgery program, and the quality officer for neurosurgery.
That is like, oh my gosh, you don't understand. I'm so excited to hear this because when we first started, like reaching out to you, I was like, okay, I have to like look up what you're doing and stuff. And I saw that you do a lot of research, especially with like cerebral palsy. And that is what I want to research. Like, my cousin has it. So it's like close to me, and that's what I want to do. So I just like hearing your whole background and stuff is so cool to me because I like want to follow in your footsteps. Like, I feel like I'm like looking up to you. But like, when did you know you wanted to be a neurosurgeon? Like, how did that come about?
I think for most people, you kind of like you have this purpose that drives you. Neurosurgery is one of those specialties you kind of have to be aware of and pursuing from a young age, just because the competition is so intense. And so you have to set yourself apart early on with research and with good grades and with dedicated activities like following neurosurgeons and being involved in neurosurgery and so on. A lot of people just don't have access to that, and a lot of people just don't come to realize that they are uh, interested in neurosurgery until it's maybe a little too late. So it's good for you to know that already, to sort of start laying the groundwork and get involved in medicine in general, and then in research, and ultimately in neurosurgery as soon as you can. I think high school is too young. College is not. So I have a lot of people around the world, honestly, but I kind of try to restrict it to the U.S. But people who reach out in college and are interested in writing papers and doing research and all this stuff.
I just can't believe the path that you took. First of all, of course, the amount of time that takes to be where you are now, of course, it's a giant commitment in itself. And then also moving all over the US to, again, pursue your career and education. And so I guess the main thing I wanted to ask was, I guess really, yeah, what kept you going? I mean, of course, there's passion, but again, I feel like there comes a lot of great discipline with that, and also moving, maybe being like exposed to different environments. Like, how was that for you? I guess just being frequently moved is what it sounds like.
Yeah, it's part of the training process. I think it's very uncommon to go to blank university undergrad and then stay there for medical school, and then stay there for residency, and then stay there for fellowship. I mean, it's just bad for your training. We call it inbreeding, kind of crass, but it is a little bit, it's less good to stay in the same institution for your whole career versus getting different opinions. And also it's good for you as a person to be uncomfortable and move from place to place to place, right? Your comfort zone can suffocate you. And so it's good to learn how to interact with different cultures, even within the U.S. Right, that every little area of the country has slightly different culture, and so it's good to move around. And I would say that if it makes you uncomfortable, it's probably good for your soul.
I like that. I actually grew up in Southern California, so when you're at like USC and stuff, I thought I kind of like resonate with that because, I've moved everywhere. I live in Florida now, but I've lived in California, New York, New Jersey, Florida. So I get what you're saying. Was there a specific place that you liked the best?
I guess Portland, Oregon, most typifies my personality. Kind of hippy dippy, like everything goes. Don't worry about what other people are doing, just worry about what you're doing. Yeah, I love Portland, Oregon. I lived there, for 7 years, but they're pretty formative years. Neurosurgery training is really hard and changes you as a fundamental human. And I think so. It's kind of like where I grew up, I guess, is what I would say. Of course, I grew up actually in Las Vegas, but I feel like I kind of became a doctor and knew what I was doing in Portland, Oregon. And it was such a beautiful place at the time. Unfortunately, it has succumbed recently to the universal unhoused problem that exists in the U.S. and you know drug problems and all sorts of COVID-19 issues and so on. But it's still a very beautiful place, and I really hope that it gets back to its previous glory.
I've never been there, but it sounds really cool.
It was a phenomenal place. Right now, it's a little bit rough, but just like a lot of like large suburban areas across the U.S.
Mhm. Could you go into a little bit more detail about your neurosurgery training? Like, what were like the years like, and how does it go, really?
Yeah, so when you graduate from medical school, you have an MD, but you really don't know anything about medicine. So you have to learn in your discipline how to deliver medical care. So your first year is basically you're called an intern. It's your first year of residency. Now neurosurgical interns are neurosurgery interns. They used to be general surgery interns, and then you would become a neurosurgery resident. So from like 9 years ago or 10 years ago to forever, probably neurosurgery interns are neurosurgery residents. They're the first year resident. And your intern and second year, you're basically trying to learn as fast as possible everything about the central nervous system and its pathologies. And then you're learning how to acquire information from patients and transfer it to people who know what to do about it. And so that's very long hours, very difficult because you're expected to know things. Maybe you think you should know things, and you clearly do not know much. Um, it's uncomfortable to be in that position, to feel like you are underperforming constantly, and then be physically tired and therefore emotionally exhausted. It's a hard time. As you achieve and acquire information and skills, you enter the operating room and you start to get some autonomy, surgical autonomy and autonomy in taking care of people, developing plans, delivering medical care. And that's really rewarding. It's still very difficult, but it's very rewarding. And then as you ascend in residency from junior resident to senior resident in your 4, 5, 6 years, you do some research, dedicated research in your area of interest, and you are basically in the OR really focusing on learning skill sets. How do I take out this tumor? What are the approaches to this, spinal cord injury? How do I achieve biomechanical stability and so on? And then your chief year, you basically just operate and you run the service. And it's a very fun year. It's a very difficult year. They're all difficult. But it's a really rewarding year, and you're basically ready for either going out into practice, and that's called private practice, or going into fellowship and continuing your educational role. And there are certain reasons you would do that. One of them is pediatrics. You have to do that. you can kind of dabble in pediatric neurosurgery, but you can't be part of like the national groups like the ASPN and so on. And you can't get board certified in pediatric neurosurgery, for example, unless you do a fellowship in pediatric neurosurgery. So that's kind of a broad overview of those years.
Yeah, what inspired you to go into pediatric neurosurgery?
So I liked everything about neurosurgery, all of the different pathologies and approaches. And if you go into adult neurosurgery, unless you live in a rural setting or you're truly a generalist, you're going to have to subspecialize in like aneurysms or vascular neurosurgery or spine or functional neurosurgery. There's not really a good way in adult neurosurgery to do all of the different procedures that you learn. Neurosurgery in general, we have some of the most varied surgeries that we learn of any trained surgeon. So we operate on the brain, on the peripheral, on the central nervous system, the peripheral nervous system, and its coverings and its vascular supply. So it's really an inclusive discipline. And I didn't want to give any of that up. And so one way to do all of that is to do it all in children. And so that was one of the main reasons why I wanted to go into pediatric neurosurgery. Then also, I had some pediatric patients who were very inspiring, like a patient with newly diagnosed brain tumor that was extremely lethal and he died very quickly. But along the way, he wanted to play Legos and so on. And so I'd come in early and play Legos with him. A little boy who pulled a TV down on his head, which is a very common injury for toddlers. Back when TVs were huge and heavy, now they're just like flat screens on the wall. It doesn't happen as much. But before, in the old days, they were huge, and toddlers would pull them down onto their heads and crush their skulls. And this little boy did that, and I thought he was going to die, but he actually didn't. And he had a great recovery, and he was an American Indian, a Native American Indian, and he had a name that translated to warrior, which I thought was very cool. So those kinds of injuries, those kinds of pathologies, and that history made me really interested in pediatric neurosurgery. The final thing is that I really like meeting people at their peak anxiety and sort of, shepherding them through a very difficult time, managing their anxiety, delivering care in that setting where the outcomes could be really poor, the outcomes could be really good. Some people don't really like to be on that life or death line, on that function or dysfunction line. But I think it's very interesting and rewarding.
I think that being a neurosurgeon is so like demanding, but like neurosurgery, like you said, is like the specialty where like you love it. So it's just something that like you just love doing all the time, which honestly, like I cannot wait to be a neurosurgeon because I feel like I would love it too. But what is your day like kind of? You kind of gave us like a little background, but what is your day-to-day life like as like a neurosurgeon?
Yeah, I get that question a lot. I mean, almost no day is the same. So uh, I can say the similarities from day to day are that it's going to be exciting and it's going to be long and it's probably going to be a combination of a lot of things. So some days are clinic, you go to clinic and you're mostly in clinic, but you also sometimes have operations to do on the side. Some days you're in the OR the whole time, but by the way, someone showed up in clinic and you got to go to clinic and see that patient. And there are some times where you sort of have dedicated research opportunities, and this is one of those times, right? And instead of doing research, which I've been doing most of the day, I'm talking to you all. So like things come up, and you schedule all the events that make you an academician, an academic neurosurgeon, in kind of the nooks and crannies of your day and evening and early morning. But I would say, like, if you want to know what it's like to be a neurosurgeon, you should take it in a week at a time. So for me, I'm usually on call Monday morning, or I'm usually on call Mondays. So starting Monday morning, I'm on call at 7 a.m. And so I'll get calls from all the referring doctors and hospitals in the state who need an opinion or want to send a patient here. We decide if they come by helicopter or they come by ambulance. And then I'm just kind of on call all day and night until the next day, fielding these calls and operating on emergencies. Monday, I'm also usually operating. So I have scheduled elective cases that have been usually scheduled up to 3 months before. And so I'll be operating, I'll be fielding calls, I'll be talking to the residents, and then I'll round in the hospital, which just means walking around to literally see and examine everybody that I'm responsible for, give opinions, write notes. And then Tuesday, I usually have clinic. Sometimes there are cases that came in over the night that I didn't get to or weren't emergent and didn't need to be done in the middle of the night. And then I do those on Tuesday in between clinic or after clinic. Clinic is very busy. It's like every 15 to 30 minutes, you have a new patient. So you can see 20 some patients and generate, opinions and run from room to room to room to room. It's very busy, kind of exhausting process, but important. Wednesday, I sometimes have a clinic in a different hospital with physiatrists where we take care of cerebral palsy patients. But I'm often not doing much on a Wednesday. I usually don't operate, and I have sort of time to reflect, to catch up on notes, to perform research and mentor residents and students and so on. And then Thursday and Friday, I'm generally operating or in a clinic in a different hospital, all entirely in a different city called Wheaton, where I am also taking care of patients with cerebral palsy. So yeah, I do operate on cerebral palsy patients quite a bit. So
So
there's no good answer to that question. It varies day to day.
I know this summer I was able to shadow a neurosurgeon, and I also shadowed a trauma surgeon. So it's kind of like how you were saying, like when they all came in at once, or like it was kind of like you didn't know what was going to happen when, but I just thought it was so cool when I was one of the people that came in. They took to the operating room, so I got to watch that neurosurgery. It was like the coolest thing ever. But yeah, so all doctors say it's like never like the same, but I think that's so interesting.
Yeah.
How did you get involved with cerebral palsy?
Well, so I am a pediatric neurosurgeon, but I subspecialize in functional neurosurgery. So functional neurosurgery is when we do surgery for conditions which have physiologically altered a patient, but not necessarily structurally altered a patient. So that is the case in patients with epilepsy, movement disorders, and chronic pain syndromes. So cerebral palsy patients very often have a movement disorder. Sometimes it's a straightforward movement disorder like spasticity. Sometimes it's a very complex movement disorder like mixed or dyskinetic or dystonic movement disorders. And so taking care of children with cerebral palsy is probably a third of my practice, where I do things to the central and peripheral nervous system to decrease the effect of the central or peripheral nervous system on the muscles of the body, and therefore, allow them improved quality of life, less pain, certainly less tone in their muscles, and improved function. So that's how I get involved with cerebral palsy.
That's incredible. We have a very close family friend where I live who has cerebral palsy, and it's really interesting to hear his perspective because, um, there's very little mental change, I guess I should say, or setbacks. It's all physical. And so he's able to kind of explain to us a lot of kind of feeling and like how it is on a day to day. And I think it's something that I don't want to say is overlooked, but I think it does not seek a lot of representation or kind of awareness. And so I think the fact that you're able to, on top of, being a neurosurgeon, you're able to also focus on people with cerebral palsy is really inspiring. But also, what I wanted to say is 5 days a week for a medical profession is definitely not easy. And so, I guess I was going to say, how do you really end up, I guess, either balancing your life in a way or preventing burnout? Are there any tactics that you do, or do you just find yourself typically not as burnt out as other people?
That is a very interesting and great question. I think when you interview everybody for in the medical fields, there is such a high level of burnout in the medical profession that you really have to try to understand, what are the huge benefits of the certain vocation, like being a doctor, being a neurosurgeon, versus the downsides and the burnout. There's so much to unpack here, but I think if you look at neurosurgery in general, the burnout rate is very high. The self-reported burnout rate from neurosurgeons from a survey study by Paul Klimo was 57%. 57% of neurosurgeons represented that they were burned out due to emotional exhaustion, depersonalization, lack of sort of thinking that what they're doing doesn't matter, which is incredible if you think about it from the outside, because everyone sort of elevates neurosurgeons as one of the pinnacle professions in modern medicine, right? But if you ask the neurosurgeons themselves, they're burned out. And it's for all sorts of reasons. So that's important to know, is that not everybody thinks neurosurgery is the best job in planet Earth. I do. But burnout is not a permanent state of being. Burnout is a temporary condition. Okay. And so for me, sometimes I might feel more burned out than others. I might feel burned out if I've had a couple bad patient experiences, like I get a couple infections in a row. Then I start to feel like, am I a good doctor? What am I doing here? I'm hurting people, not helping people. Let's say we have a few unexpected outcomes in a row that can really affect you as a person. You can start getting burned out. When that sort of thing happens, it's important to share that experience with your colleagues, to talk about it and not just internalize it, and to recognize or do what I call, and other people, I got this from other people, it's not my own idea, examine the evidence. So what is the evidence that I'm the worst doctor in the world? Well, I mean, there's not a lot of that evidence. There's probably some, but so that sort of thing helps you kind of, contextualize what's going on and then move on. Certainly having hobbies that are outside of medicine that rejuvenate you are really helpful. And this can be any hobby, right? So I put puzzles together, for example. I bird watch with my wife. I used to live on a lake and I would kayak and stuff. Now I just do physical activity, which is a endorphin generating sort of phenomenon. And then maintaining relationships is critical. So keeping yourself multidimensional will help you not get burned out in your profession.
That's kind of funny that you said the relationship thing, because at the end of our interviews we usually do like rapid fire questions, and one of them is, what's the importance of relationships? So I guess we could go more into that later, but we agree, because we're like long distance best friends, we could say. And like it's important for us, which is we always want to like ask people that are like doctors, and we want to know what they think. But I just was wondering, you said before that you teach kind of at Northwestern, right?
Yeah, so I'm an assistant professor of neurological surgery in the Department of Neurosurgery at Northwestern University.
So how does that, like, what is that? Like, what do you do?
Yeah, a lot of people, I mean, because your whole life you've had people stand at the front of the class and talk to you about stuff. I don't do that. I do, of course, if asked, but like my main appointment is not teaching medical school classes in the School of Medicine. It is experiential training for residents of neurological surgery and fellows of neurological surgery. So I teach a select group of people how to operate on children in the operating room every day. And I teach them how to acquire the judgment to determine who needs to be operated on, how, and who does not need to be operated on and should be sort of referred to other doctors who might be able to help them. So it's an extremely rewarding and fun job. It's when I'm in the operating room operating on a child, my number one job is to make sure that that operation goes well and the child does well. But I have a competing job, which is to educate the resident and or the fellow who happens to be operating with me. So that's kind of two jobs in one. And it's fun. A lot of people love it. It's one of the most rewarding parts of my job. A lot of people don't want to do it or they're not good at it and they go into private practice.
I think that, I mean, especially being at like a big university like that, that's such like a very prestigious. I know that I'm applying there this year because we're in our application like mode. But
Good luck.
thank you. I know I'm applying to Northwestern because it's such like a prestigious place, and I know that people would probably come from like everywhere just to learn from you. So that just sounds like it would be such a rewarding job. Like I totally I
Yeah, it's not just me. I mean, I'm just one person. I'm one person in a huge department. But yeah, we get people coming to train with us from around the world. We've had, I think, this year so far 6 international surgeons who are surgeons. They're surgeons in their own country, like Italy and stuff, and they come here and they train with us for a while. Then they go back. Hopefully, they bring cool techniques or ideas or whatever with them. And then there are residents that come from around the world and around the country, of course, that train here in Chicago. We are at Lurie Children's Hospital, which is an affiliate site for Northwestern. We are a top 10 program in pediatric neurosurgery, and so we get a lot of people. We also train residents in neurological surgery from 4 different programs who come through here. So we get a lot of exposure to people who are in training, and they're universally very good.
you said that you teach them like cool techniques and stuff. What are some techniques or surgeries that you find to be the most interesting or even the rare ones, stuff like that?
Man, surgery, all of surgery is cool. But I do the coolest surgeries. Um, let's see. I use a cranial robot to implant electrodes into the brain in an effort to identify a seizure network. And then I replace those electrodes with lasers and destroy that tissue. And then these patients go home the next day, and they have they have like little tiny 3 millimeter scars, smaller than my pinky nail. So that's a cool surgery. Not very many people in the world do that. In fact, I was the first person to do that in Indiana when I started working there. And then they were doing it a couple times here at Northwestern, but I've come and really made that program a little bit bigger. That's one cool surgery. I implant cybernetic devices like deep brain stimulators and responsive neurostimulators in the brain in order to help modulate movement disorders and epilepsy. I implant stimulators above the spinal cord to help modulate pain symptoms in patients who have chronic pain. I invented a surgery last year, which has never been, this particular surgery has never been done, but it's for patients with cerebral palsy who have spinal fusions and are unable to walk. And they often have very few options to disconnect the central nervous system from the muscles. And so me and my group here invented a surgery using needle electrodes that you can heat up at the tip and destroy stuff. So we use computer navigation to put those electrodes into spinal nerve roots and then heat up the electrode and destroy those spinal nerve roots. And we just published that, I don't know, recently, maybe last month or this month. So those are some cool surgeries that we do here at Northwestern.
I have to ask how you even begin to invent a surgery. I mean, that's incredible. Is that like research conducted? How long did that take? I mean, I've never heard of that. So that's incredible. And congratulations, of
Oh,
course.
thank you. Yeah.
Congrats.
Well, so surgery, I always say surgery is a lot like making a sandwich. There are steps to it that anyone can learn. So sometimes you do the steps in a little bit different way, or you include things that other people might. Like when you make a peanut butter and jelly sandwich, sometimes you might put butter on the bread. I would never put butter on the bread, but some people do, right? And so that's an example of sort of surgical nuance, right? Maybe you put the peanut butter and the jelly on the same piece of bread and then put the dry piece on there. This is exactly like surgery. Every surgeon does it just like slightly different, but overall, we're making peanut butter and jelly sandwiches, okay? And when you make a peanut butter and jelly sandwich, there are modular component parts, right? Putting peanut butter on the bread, that's a component part of that surgery of making that sandwich, putting jelly on the bread, right? Or putting jelly on the peanut butter, which would be weird, but some people do it. And so this is how I conceptualize surgery. There are modular component steps to surgery, to all surgeries. There's positioning the patient, there's the incision, there's the soft tissue dissection, there's the bony work, then there's the, central nervous system work, and then you get out, you close everything, right? Um, so when you're presented with new problems that don't have a solution, you can reflect on your knowledge of the modular component steps, and you can put them into an order that makes sense for this particular problem. And so that's how you invent a new surgery. So for this particular patient, like making an incision and drilling through the bone, and it just doesn't make sense. It's not feasible without a risk that's a little too high for me to offer a patient. So I did go to the literature and look at what were things that people did before. And the reason I did that is because I reflected in residency. I remember working with my chairman about doing surgery for a patient with a spinal cord injury. And we introduced these radiofrequency ablation needles, these needles where we could heat up the tip. I remember doing this with him. I did it like once or twice. But I was like, I wonder if that technique might be effective here. Now, it was like intensely complicated with this particular cerebral palsy patient because of his scoliosis and his spinal fusion. And in the past, I remember that we didn't have that problem. So then I was like, well, I can't just like stick electrodes into nerve roots in a patient with a fusion and a twisted spine. Like I'm not that good. Maybe no one is. I don't know, but it's not possible for me. So how can I integrate navigation for this purpose? And so that's how I sort of put it all together. Then I like know how to do navigation. I know how to do radio frequency ablation, and now we're kind of figuring out how can we use and identify different surgical materials to accomplish this task. And so then I did practice with it on a piece of chicken. And I was like, okay, I get it. Like, I know how to do this. I use navigation for spinal fusions, right? I use RFA, radio frequency ablation, for all sorts of things. And I just use it in chicken. So I know that I can do it here at Lurie Children's. And then you talk to the family and you say, look, this has never been done before, but like, I know how to do it. I mean, it's pretty straightforward. Like it's this step, then this step, then this step. And then if the family trusts you, then they say, let's do it. I mean, we don't have very many other options. So that's how it happens.
That's literally like the coolest thing ever. I honestly cannot imagine like making a surgery. Like that is just the coolest thing I've ever heard in my life. But like we said, congrats about that. Did you end up doing that? Did you end up doing the surgery?
Oh yeah. Yeah, we did it. It worked great. And it's published in the literature. There's a phrase in academia that is something like, if you didn't publish it, it didn't happen. So we published it, and the family is talking to marketing, and they'll probably come out and talk about how effective it was and so on. But yeah, we did it. And we'll do it again. I mean, it's not like you did it once and congratulations, right? I mean, the idea is that it's an effective strategy for a certain population of patients, and we should be doing it for those patients and then promoting it to other people so that they can learn to do it. And that's the goal.
So with your, I guess, professor teaching job that you have on top of like being a neurosurgeon, do you with your, and you have your nonprofit, which I find super cool. Do you do that stuff with the people in your nonprofit, or do you do that with like the residents, or are they the same? Like, how does that work?
The surgeries? Are you asking about the surgeries?
Yeah, like creating stuff and doing research, like how you created your surgery and you do the surgeries, but like that.
So yeah, the surgeries that I perform, legally and ethically, the only people allowed to operate with me are residents, and fellows. So, and medical students. Medical students can operate too. And then the amount of stuff that they do is up to me. The hospital trusts me to train people in an effective and safe way. So I can't just take anybody off the street and give them a scalpel, right? But almost anyone can rotate here and follow me around and see what I do on an everyday basis. That's fine. That's you have to be basically in college, but that's fine. The nonprofit that I have is something my wife and I started that I have always been very interested in to improve uh, diversity, equity, and inclusion in neurosurgery. It's a predominantly white male field, and with even with like focused attention in improving the diversity, it has really not improved very much at all. I think still it's only like 15 or 17% female, and the underrepresented minority volume or percentage is also still extremely small. So one of those reasons is because you have to be intensely focused in neurosurgery from a very young age. And of course, there's a ton of privilege that comes along with being a white male and not in other people. And one of those is unpaid research. So if you can afford to do unpaid research, then you get research credits, and then you have like a leg up on everyone else who can't do that. So the nonprofit that we have is to help level the playing field, and it's basically just for people who are interested in neurosurgery or neurosurgery residents who are interested in pediatric neurosurgery. We give you $5,000 for 10 weeks, and you do whatever you want with your $5,000. Maybe you pay your rent, maybe you do whatever you got to do, but it buys your time, and your time is spent with me and my group, learning about research. It's called SMERF, SMERF, Student Mentorship, Education, and Research Fellowship. So you're with me, I'm mentoring you, I'm teaching you, and we're doing research together. And ultimately, hopefully, you have at least one manuscript at the end of that time.
That's incredible. A big thing that I'm personally interested in is my goal major right now is to major in public health. And that is one thing I find extremely important is the socioeconomic determinants of health. And so by, having I guess to say like different demographics, education, race, gender, everything is also played into your health. And I think again, education makes up a giant proponent of that. And so I think that that is something, again, that is very overlooked. And it's really respectable to see you taking action in that, specifically in something you are so passionate about. And so I think that's really just a great way to, how do I put this? I guess just a great way to really emphasize the importance of diversity in the workforce, especially within medicine and neurosurgery in general. So
Yeah.
I guess one thing is, how do you typically receive funds for your nonprofit?
Gosh, I wish that other people would donate, but it's entirely self-funded right now. I mean, I donate the money myself. It's open for donations if you know anyone who wants to go to smurf.org and donate money. There have been a few people who have donated, a few $100s, and I'm thankful for that. But the vast majority is just my own money. I mean, I think this is a right now passion project. I mean, first of all, I love mentoring and educating people. Research is critical to the success of my own career, so I'm doing it anyways. And other people need it, so I feel like it makes sense. Plus, if I can mentor effectively other students and so on, then the amount of publications that I get goes up dramatically, right? So that's my own benefit. But yeah, I've tried to reach out to industry partners, and they just aren't interested, even though they say on their websites they are interested in diversity, education, and inclusion. When I ask them for money, they do not give it to me. So maybe in the future.
I was just wondering, how does somebody, I mean, do you have like an age limit? Is it just medical students? Is it residents? Like, who can be a part of this?
Yeah, Smurf is restricted because it's like only me basically doing the education, mentorship, and research. So I can't have like 100 SMERF scholars. I couldn't afford it anyways. But so it really is dedicated to like third and fourth year medical students who want to do neurosurgery, because that's like right in the time where they would start to apply for residency, and they need research and they need credentials and they need to understand what it's actually like to be a neurosurgeon. A little bit of this glossy sheen of like, I want to be a neurosurgeon comes off when you start living a neurosurgeon's lifestyle. And and you should know that. I would hate for people to get too far invested into this career before they recognize there's a large burnout rate, there's a large divorce rate, there's just a dissatisfaction in a lot of ways for a lot of people. Um, so third and fourth year medical students going into neurosurgery, and then neurosurgery residents who want to do pediatric neurosurgery.
How did you come up with the idea?
Um, well, it's been my idea for a long time. My idea to have mentees that were working with me. I guess I probably borrowed it from one of my friends and colleagues, Ahmed Raslan, who was at OHSU, and he has a Raslan lab. And there's a certain medical student or resident or graduate student or someone who he pays like a living wage, like $50,000 or $60,000 to run his lab, which is I understand that most virtual environment, but there's a ton of projects, right? And so each project needs to be moved downfield until it eventually crosses the goal of being published. And so I think I borrowed it from him probably if I really reflect on it. But the idea of mentoring students and residents in a personal way, that's my own idea. It's education and research that I kind of borrowed from Ahmed.
I think that especially how we were talking about, obviously, like the diversity thing, and especially the fact that you self-fund it, all that stuff, and how you're so passionate about it. It was your own like idea and vision. I think that's so like admirable, and I think that's like, thank you for doing that, because I think it's important. Like, I wrote about my college essay that like because when I was shadowing the neurosurgeon, I had like a whole thing, and they were like, didn't think I was like actually going to be a neurosurgeon. They were like, you're going to be a nurse, like you're going to be a nurse. I was like, what? So then I wrote really about that. That's really kind of what Sienna, and that what I came to Sienna with it, that, and I was like, we should like really like make this podcast like for feminism and STEM, and for like women in medicine and that. So I think it's so cool that you like are actively trying to change that, because like there's like 219 women like that are neurosurgeons out of like all the neurosurgeons in the US, which I think is like not okay. So I think what you're doing is really
Yeah.
great. So thank you.
My pleasure. Yeah. And good for you for, I mean, I think what I would caveat what you just said is that nursing careers are excellent careers. It's not, inherently pejorative to say you'd be a nurse, but I understand certainly that there's this inherent bias against women. And can you be a doctor and can you be a neurosurgeon? The answer is definitely yes. So if you wanted to be a nurse, that'd be a great job too. If you want to be a neurosurgeon, you'll be probably a great neurosurgeon.
No, yeah. So I love nurses, but I was like, I want to be a neurosurgeon. They're like, no, you're not. And I'm like, But anyways, like you said, kind of with like the divorce rate, and you said before that like relationships are important, I think we can start to kind of like segue into the rapid fire questions,
Okay.
which aren't actually rapid fire, but you could answer as long or as short as you want.
Okay.
um but I guess the first question could be, how do relationships play an important role in your life?
Oh, well, yeah. I mean, relationships are important. You should have some really trusted confidants that you can bounce things off of. For me, I have a couple of very good friends, and then I have my wife, who's my best friend.
That's incredible. How does what was I gonna say? Oh yeah. I guess like with, of course you have a very demanding job. Does your wife also have a career maybe similar to yours? Do you guys have different careers? Does she have a career? How does your relationship kind of, I don't want to say work, but how do you guys really prioritize each other, I guess, in your relationship while also working or having a separate life as well?
Yeah, I mean, my wife is much more impressive than me. She is a very, very smart lawyer vocationally. She's a lawyer. She works for an autonomous vehicle company, and she's also a fully trained actor. And so she does the two careers. Her name's Tia Link. If you look her up online, she has like 80 film credits or something. She
Wow.
also speaks a bunch of languages, and she's a real impressive person. Uh, so we have separate careers that don't overlap at all. But we focus on each other when we can, which is frequently. We do things, and we don't have kids, and so we have very few stressors. And so we just do whatever makes us happy, and we have a lot of time on the weekends, most weekends. As a neurosurgeon, I'm on call, one out of every four, usually 4 weekends. So the other 3 weekends I have free to be with my wife, and we do all the things I talked about in the hobby section.
Like it's good, like how you said, have like people around you that like you can depend on and stuff, because obviously we're not neurosurgeons, but like in high school too, we're stressed out, and like
Yeah.
even just us two talking it makes us feel kind of relieve the stress, because it can get really bad.
Yeah.
Going into our second question, one thing that obviously being high schoolers, we have a long way to go in our careers professionally and personally. And I guess on the long journey you've been on, what is one piece of advice that you would give your high school self?
Wow, good question. Uh, Phew. God, I'm like a totally different person. Wow, that's a good question. What advice would I give my high school self? Um, maybe things are never quite as good or as bad as you think they're going to be. There's a lot of times, yeah, in my life where I've been like, this is the worst thing that's ever happened. And then there are a lot of times where I've been like, this is the best thing that's ever happened. And almost always they're wrong. So,
I think I definitely do this, I know, but things will frequently go out of proportion than needed. And
yeah.
so I like to think, we have such big lives, but we are so small in perspective to everything else going on in the world and in our universe and whatnot. So
Yeah, I guess like the point behind nothing is ever as good or as bad as you think it is that we are like inherently emotional creatures, and often it is over exaggerated, and then that's not usually helpful. So um, that is the underlying message to my high school self: is like just take everything with a bucket of salt. It's all going to be okay.
I need
Yeah, we
that.
definitely need that. Yeah, we need that for sure. Like struggling in AP bio, but we won't talk about it. Anyways,
Our third and final question is, what is one thing you are currently struggling with, and what are you doing to overcome it?
Hmm. What am I struggling with? Well, um, gosh, I mean, I don't have too many struggles. Um, wow, these are good questions.
I guess it could be also something like you're hoping to improve in, or next steps that you may have in your career or life. Is there anything that you find like you can see some growth in?
Okay, well, we just talked about I'm struggling to find donors for my nonprofit. So I'm
Right?
also, yeah, I'm also struggling to find candidates for my nonprofit because I found like several people applied. Two of them were like extremely qualified, and we extended to one of them a contract, and then they unfortunately sent it to their university, and so now their university wants the money, and I'm not going to do that. So now I have to find another candidate. So because we're not very known at all, we just got started. We don't have a whole bunch of people who are applying for these roles, so I don't really have a candidate right now. And then also because we don't really have a candidate and stuff, I can't get money to fund it, so it's a frustrating process. But
Fortunately,
you know, yeah. But I think word of mouth and just persistence. I mean, things don't happen immediately, even though you might want them to happen immediately. Everything is a process. If it was easy, everyone would do it. And if you're passionate about it and the work is worth it, then you just keep going.
absolutely.
And if there's any people out there that are interested, check it
Yeah,
out.
check it out. SMERF.org.
Spelled SMERF.
Yeah, for education.
Yes, I was looking it up. In before class started, and my friend walked by and was like Smurf, and I was like, check it out. Like,
Yeah.
it's like, look at it. I'm like interviewing this guy.
Yeah, it's on. Okay, we have an Instagram. We have almost 30 followers.
Yes.
Okay, we're gonna tag.
You should. Yeah, you should tag Smurf, and also that'd be great. I appreciate it if you do. And also, if you if you continue on your neurosurgical journey and you need money and research, then look us up.
Totally. If I get into Northwestern, I will be, can I shadow? Like,
Yeah, of course. I see the medical school from my apartment. Like I live right here, downtown Chicago. So
Yes.
thank you so much. Like, this meant a lot, and I have been talking about it for 2 weeks. I was like, I thought it was 2 weeks ago. I'm not, like, it was kind of bad. Like, Sienna got off a plane, and I was like, oh my god, it's today. Like, I'm so excited. And then she's like, no, it's not. It's like in 2 weeks from now. And
I said I was taking a nap, and she was like, you have to set an alarm. And I was like, for what? And she's like, for our interview. And I was like, Maddie, 2 weeks from today. 2 weeks.
Literally. I was talking to everyone about it at school. I was like, guys, like, I'm so excited. And then everyone was like, the next day, how'd it go? I was like, it wasn't today. Wasn't today. I was so upset. I was like, what am I thinking? Like, when?
Well, this has been very rejuvenating talking with you both, and thanks for having me. And I'm proud of you for doing this. I wasn't doing any of this when I was in high school, so you guys are free thinking, change the world kind of people. So keep it up.
Yes, thank you so much again.
Thank you so
You're
much.
welcome. You're welcome. Good luck in AP Bio.
Thank you.
If you come over here, not doing too good.
We're like,
Yeah.
like
Bye.